Imagine if one simple change could dramatically slash your risk of stroke, heart failure, and even dementia, all by adjusting a number most doctors overlook in seniors. New research reveals that many beliefs about normal blood pressure for seniors are dangerously outdated. Stay tuned as we break down the latest 2024 breakthrough research and show you how the right blood pressure could add extra healthy years to your life. Welcome to HealthPulse Haven, where we decode the secrets of living a healthier, longer life for seniors and their families. Today's episode tackles the question, what should your blood pressure really be after 60? We'll dive into eye-opening studies, international guidelines, and give you practical steps to protect your heart and brain. First, let's get clear on what blood pressure numbers mean. Blood pressure is measured as two numbers. The top is systolic pressure when your heart pumps, and the bottom is diastolic pressure when your heart rests. For most adults, normal has long been 120/80. But should seniors accept higher numbers due to age? This is where science gives surprising answers. Many of us grew up hearing that a little high BP in old age is fine. But in truth, that mindset has silently hurt millions. Your arteries don't get stronger with pressure, they get more damaged. Just like an overinflated balloon, too much force over time weakens the walls. If you're over 60, you've probably been told a little higher blood pressure is just part of aging. But what if keeping your pressure too high could secretly damage your eyes, kidneys, and even your mind? As we age, blood vessels stiffen and other conditions like diabetes, heart disease, or cognitive decline become more common. This changes how our bodies react to high blood pressure, making both high and low readings especially risky. Uncontrolled hypertension can quietly harm organs for years, causing strokes, heart attacks, kidney damage, even blindness. But on the other side, too low blood pressure can cause dizziness, confusion, or falls, especially in the elderly with frail bodies. Now, here's the plot twist, the ideal blood pressure for one senior could be dangerous for another. Personalized care is key, and the newest research spells out exactly how. The STEP and SPRINT trials have turned expert advice upside down. Thousands of seniors over 60 were studied. Those whose blood pressure was controlled to a lower target, 110 to 130 for systolic, had up to 26% fewer heart attacks and strokes, and up to 34% fewer fatal events, compared to those with higher targets. Even more interesting, participants who achieved lower pressures also showed improved memory and better kidney function in long-term follow-ups. It turns out, healthy blood pressure doesn't just protect your heart, it keeps your brain sharper too. Similar results were seen all over the world. 2024 guidelines now say that in most healthy seniors, targeting a blood pressure below 130/80 gives the best protection against heart problems. But wait! Did you know more aggressive blood pressure medication in seniors does not increase their risk of falls, according to massive new studies? Let's clear up this myth with facts. For years, it was thought lowering seniors' blood pressure too much would make them faint and fall. In fact, new research on nearly 300,000 patients found that certain blood pressure medicines even reduce fall risk. The real danger comes when blood pressure is too low without personalized adjustment, or when medications are not monitored carefully. There's another life-saving secret almost nobody talks about. One hidden condition affects 1 in 4 seniors and can silently turn blood pressure treatments dangerous. Orthostatic hypertension is when blood pressure drops suddenly upon standing, causing dizziness or fainting. To check for it, measure your blood pressure lying down, then standing after 3 minutes. If it drops by 20 mm of mercury or more, talk to your doctor immediately. This can increase fall risk and strokes if untreated. A quick home check once in a while can reveal a problem that even regular clinic visits might miss. That's how subtle, yet crucial, blood pressure control can be. Let's zoom out. Should all seniors aim for strict blood pressure targets? Not quite. Some need extra caution. Recent guidelines highlight 3 special groups: frail elders, especially over 80, people with stroke or mini-strokes, and high-risk seniors with heart or kidney disease. For frail elders, targets may relax to 130 to 150 mm of mercury, as higher reductions could cause harm. For people with a history of stroke, aim for under 140 mm of mercury if possible. For high-risk seniors, aggressive control below 130/80 mmHg is recommended, but always customized to individual tolerance. Treatment is always about weighing risks and benefits, and involving patients in the discussion. So, the right question isn't what's the perfect BP number, but what's the perfect number for me? Here's where you take charge. The greatest power is not in the prescription pad, but in your habits. The next 5 minutes could change your future. Medication: never skip doses or change meds on your own. Seniors often need more than one medicine, but doses should be increased slowly. Lifestyle: daily movement, a low-salt diet, and managing stress can lower blood pressure more than you think. Even modest weight loss helps. Monitoring: check levels regularly at home, keep a log, and share this with your doctor. Regular review helps catch issues early. Family support: engaging family or caregivers in health routines boosts motivation and ensures warning signs aren't missed. Even small daily habits, like staying hydrated, stretching, or cutting processed food, can make a measurable difference on your BP monitor. Ever wondered why some seniors struggle to control blood pressure even with all meds? Let's uncover some less-known causes next. Occasionally, unknown kidney issues, medication side effects, or even sleep apnea can drive up blood pressure. If things don't improve despite best efforts, ask your doctor for further testing. Even some common medications, like certain painkillers, can quietly raise pressure in seniors. Your pharmacist can double-check your current medicine list for hidden risks. Prepare: bring your BP log and list all medications and supplements. Ask: is my target right for my age and overall health? Have I been checked for orthostatic hypertension? Request: review personal risks, discuss any side effects, clarify when to call for help. Repeat: regular check-ins are crucial, especially after any change in medication. Bottom line: thanks to new, powerful research, the ideal blood pressure for seniors is now more personalized than ever. For most, below 130/80 is safe and protective, but always in consultation with your doctor. If you want to live longer, healthier, and avoid life-changing complications, act on this knowledge now. Share this video with other seniors and caregivers so everyone can benefit. Subscribe to HealthPulse Haven, and let us know in the comments what topics you want us to cover next for senior health.